Americans across the country have been sounding the alarm on outrageously high medical bills. CBS News and journalists at Clear Health Costs are continuing to look into complaints from viewers about the soaring price tags. One woman from Texas says she still owes $20,000 after a trip to the emergency room. Consumer investigative correspondent Anna Werner spoke with her, and she joins us now. So what kind of toll is paying these bills having on this young woman?
Well, for example, this 32-year-old bride-to-be, Don, says this sudden huge bill changed her understanding of her insurance, her financial picture, and even her wedding plans.
I thought that I was dying. It was really scary.
You thought you were dying?
I did, yes.
Molly McKenna says her medical and financial trouble began earlier this year with excruciating abdominal pain.
Hands down, the most painful thing that I've ever experienced in my life.
Her fiance took her to this Baylor Scott & White clinic where doctors told her it was an emergency.
The doctor came in and said, "Your ovary is a big hemorrhaging mess right now. We have to take that out."
She was transferred by ambulance to a larger Baylor Scott & White hospital for surgery where she presented her insurance card. But a few weeks later, she was told she was out of network.
I said, "Out of network? What does that mean for my surgery that I just had?" And she said, it's looking like the balance from our facilities is up around $40,000.
$40,000?
Yeah. Yes. My heart just dropped.
McKenna joined more than 600 other people who responded for our Medical Price Roulette series, which highlights the gamble consumers face with medical pricing.
What does it say to you that so many people had stories to tell us?
It says that something is very broken.
What's broken in McKenna's case, says her insurance broker Laura Everest, is the hospital's pricing system.
If she had been charged the fair rate, she would be out very little money.
So you basically think that they're gouging?
Absolutely.
That's because Everest says McKenna's insurance already paid over $6,000 for the surgery. McKenna negotiated some bills down, but Baylor Scott & White still demanded $27,000 more.
What's your understanding of why the rate was what it was, the price?
Because there is no guideline. There is no transparency. They can charge whatever they want. So she basically got taken advantage of.
With the bill unresolved, McKenna and her fiancé decided to skip the wedding they'd hoped for with friends and family. She says they've decided to elope instead.
I'm not a person. I'm not a human to them. I'm a dollar sign.
Baylor Scott & White told us its facility charges are lower than other acute care hospitals in the region. But after we asked them about McKenna's charges, the hospital system said her case showed what it calls an opportunity for improvement. Although it did not answer our questions about the amounts she was charged, it now says it will contact Molly McKenna to work towards solving her problem, Don.
All right, so if I take my car to a local repair shop, say for transmission problems, they're going to give me a ballpark figure. Hospitals are under no such requirements to do that. So what can people do when they find themselves in a medical crisis and still take care of themselves financially?
So a few tips. One is plan ahead for emergencies in the sense that find out which hospitals closest to you are in your network. So, for example, if somebody you love is taking you there, you can have a plan, maybe even on the fridge, go to XYZ hospital, which will help you. Number two, if it's not a life-threatening emergency, maybe go to the urgent care or the urgent care center or the walk-in center. That's going to be a lot cheaper than going to the regular emergency room. And number three, you can ask or have someone ask with you in the ER. It might not always work, but you can ask at least, hey, are the doctors treating me in network? In certain emergencies, they're just there to save your life, and frankly, whoever does it is going to do it, and that's a good thing. But it's worth keeping that in mind, and that tip from our partner, Jeannie Pinder over at Clear Health Costs, who says, look, at least you can ask. By the way, you saw the illustration there. You can still share your prices with us. We're still looking for people to tell us what they are paying out there nationwide. You go to cbsnews.com/healthcosts. Or you can email us at healthcosts@cbsnews.com. You see that there? You click on that button that says share and search prices, cbsnews.com/healthcosts. Click through the menu, share and search, and then you'll land on the page where you can enter your information.
Since you started this, have you gotten a sense of how widespread this issue really is?
Boy, have I ever. I mean, we have people writing in with heartbreaking stories, heartbreaking, frustrating, devastating stories, and you want to help everybody immediately. You want to look at everybody's case immediately. We've had so much response that we can't immediately respond to everybody, but we would like to try to at least highlight some of the issues that are affecting people around the country, and we're going to keep reporting in this series for the next several months.
I have to tell you, it's great journalism, but it's also great community service. So,
well,
really happy you're
if we
doing
can
it.
help people to understand more about how do they control their health costs, it might not fix your problem with your insurance plan or whatever, but at least you can be mindful of some strategies to use. And by the way, fight the bill or negotiate the bill. If you get a big bill like this, always try to negotiate it.
Yeah, good advice. Anna, good to see you. Thank you.
Thanks, John.